Hello, everybody. My name is Logan Halick. I'm a graduate student studying social work at the University of West Florida. I'm here today to speak to you about mental health and substance abuse in this presentation I prepared. Mental health is a topic of education and life that is ever growing and ever changing. It has a massive scope of ideas, theories, perceptions, and practice with a wealth of experience and knowledge accumulated from scientific minds of people across the globe. In one way or another, it's likely you have experience or awareness of mental health from social media, school, friends, family, the news, or even life experiences. As for substance abuse, it's very likely that you or someone you know has experience in this category, as 48.5 million Americans, roughly 16.7%, aged 12 or older, battled a substance abuse disorder in the year of 2023, according to a United States National Survey on Drug Use and Health. Unfortunately, substance abuse is prevalent in American society and is very much an epidemic that can affect you and those around you. Substance abuse is a disorder that goes hand in hand with mental health. It is important as a society and a culture to shed light on why this is an important issue and topic of conversation, to develop policies to aid this epidemic and spread awareness to inspire advocates and lawmakers alike. In my presentation, I'm going to speak on many topics of mental health and substance abuse to paint a picture of what the state of affairs are for the American people concerning these issues. To start, I'm briefly going to talk about history and definitions. I'm going to talk about how this is affecting the American people right now. I'm going to talk about how this applies to social workers on a micro, meso, and macro level. And then we're going to transition to dated US policies versus modern US policies regarding mental health and substance abuse. And then afterwards, we're going to go into some current local, state, and federal policies that are currently in place. And then to conclude, we'll talk about ethics, justice, and advocacy. So, as far as the history goes, it's pretty grim. Mental health and substance abuse has been looked down on historically. Mental health has long been stigmatized in American society. Historically, individuals experiencing mental illness were institutionalized in asylums with inadequate treatment and poor living conditions. The deinstitutionalization movement of the mid 20th century aimed to transition individuals to community based care rather than institutionalism, but a lack of adequate funding left many without essential services to treat mental illnesses or substance abuse disorders. Similarly, substance abuse was traditionally criminalized rather than treated as a public health issue. The war on drugs of the 1980s, led by the Reagan administration, led to mass incarceration rather than rehabilitation. Disproportionately impacted marginalized communities. These historical contexts have shaped the policies we see today. And as we keep addressing these issues, it'll pull us more into the future, and we'll see how modern policies really made a change for how we view these issues and how we solve them. And then going on to defining mental health and substance abuse. Mental health, as defined by the World Health Organization, is a state of well-being in which an individual can cope with normal stresses, work productively, and contribute to society. As far as substance abuse goes, it's defined by the American Psychiatric Association, since it is a mental health disorder. It involves the misuse of psychoactive substances leading to significant impairment or distress. Both issues intersect with social determinants of health, including socioeconomic status, trauma, and access to care. So, the modern state of affairs of how we're looking at mental health and substance abuse, it's not looking very great at the moment. According to the National Alliance on Mental Illness, 1 in 5 adults experiences a mental health illness annually, yet only half receive treatment due to barriers such as cost and stigma. The opioid epidemic remains a public health emergency with over 100,000 overdose deaths in 2022 alone, according to the CDC. Additionally, the COVID-19 pandemic has exacerbated mental health challenges, increasing rates of anxiety and depression from its launch in 2020. All right, now how do social workers fit into all this? Well, they have a critical role to play in addressing these crises by providing direct services, advocating for policy changes, and educating communities. The National Association of Social Workers emphasizes the importance of evidence based practices, including cognitive behavioral therapy and harm reduction strategies. Furthermore, social workers must address systemic inequities contributing to mental health disparities, such as racial discrimination and economic inequality. So, on the work that social workers do, on the micro level, they usually tend to provide individual therapy, case management, and crisis intervention to clients struggling with mental health and substance abuse issues. Meso level social workers often work within communities, advocating for better access to mental health resources in schools, hospitals, and rehabilitation centers. And we see a lot of these in the form of nonprofits. Macro level social workers engage in policy reform, lobbying for increased funding for mental health services and the decriminalization efforts for substance abuse treatment. Now, when we talk about past failures when it comes to policy in regards to mental health and substance abuse, we had quite a few blunders, but we have policies that were similarly trying to do what they were doing, but better in the more modern times, and I'll tell you about that in just a second. So, for a past policy such as Mental Health Systems Act of 1980, they aimed to improve federal funding for community-based care, but were quickly repealed under the Reagan administration. More recently, though, policies such as the Affordable Care Act expanded mental health coverage through parity laws. Historically, federal policies such as the Anti-Drug Abuse Act of 1986 mandated severe sentencing disparities between crack and powder cocaine possession, disproportionately affecting black communities. But in contrast, the 2010 Fair Sentencing Act aimed to reduce these disparities. Similarly, the Community Health Act of 1963 sought to provide community-based care, but its underfunding led to mass homelessness and incarceration of those with mental illness. So modern policies such as Mental Health Parity and Addiction Equity Act of 2008 enforced equal insurance coverage for mental health and substance use treatment. Additionally, the 21st Century Cures Act of the 2016 provides funding for mental health and opioid treatment programs, reflecting a shift towards public health approaches from the opioid epidemic experienced in the years before. And to talk about some policies on the local, state, and federal level, we have quite a few. So there are now crisis stabilization centers in cities like San Antonio that have established centers there to divert individuals with mental illness from jails and emergency rooms. Then we have safe injection sites. New York has implemented supervised injection facilities to reduce overdose deaths and increase access to treatment. And some cities, such as Northport, Florida, where I am from, have implemented crisis intervention teams that pair police officers with mental health professionals to reduce unnecessary incarcerations. Now, when we go to the state level, we have Medicaid expansion. States that expanded Medicaid saw increased access to mental health and addiction services. We have the California Care Courts. California launched care courts to mandate treatment for individuals with severe mental illness in 2022. And then we have states that are doing things about drug possession. There are 7 states right now, including Oregon, that have decriminalized small amounts of drug possession, shifting focus to treatment over incarceration by providing services to those found with or who found with while they were possessing drugs. Now, some federal level policies that we have are the Support Acts of 2018. They expanded prevention and treatment efforts for opioid use disorders. We have the Restoring Hope for Mental Health and Well-Being Act of 2022. It's legislation that aims to reauthorize, expand, and modify various programs and grants focused on mental and behavioral health through the fiscal year of 2027. Then we have the Support for Patients and Communities Act of 2018. They expanded substance use disorder treatment and prevention efforts nationwide. And a lot of these programs were headed by a department in the federal government called the Substance Abuse Mental Health Security Administration. So we got to ask, after all of these programs that we've done and all these policies that we're making in the modern times, mainly from around 2016 to currently, are we doing enough? And while some policies have made progress, there's still much to be done. The criminalization of substance use, lack of universal mental health coverage, and racial disparities in treatment access remain pressing issues. Advocating for policies that prioritize harm reduction, increase mental health funding, and address social determinants of health is essential for advancing human rights and social justice. Current policies still face ethical challenges. For example, while drug decriminalization in Oregon aims to reduce incarceration, critics argue that treatment availability remains insufficient. According to the Drug Policy Alliance in 2023, racial disparities persist as Black and Indigenous Americans continue to face higher rates of criminalization for substance use. So, are we doing enough? Many argue that while progress has been made, systematic underfunding and continued stigma hinder true reform. Advocacy efforts must push for universal mental health care access, harm reduction strategies, and investments in community-based solutions. Mental health and substance abuse policy must evolve to better serve the well-being of all citizens. As social workers, policymakers, and community members, we must critically analyze existing frameworks and advocate for meaningful change. So we want to increase funding. We want to address social determinants as a way to move forward as we continue to be making policies that are crucial to mental health and substance abuse disorders. And to do that, everyone needs to come together and really find the best ways to manage these programs and to use them to their full extent. I didn't mention it in my PowerPoint, but something that is a federal program that really is misused a lot is TANF. A lot of TANF money goes missing and doesn't get used, and it's very poorly managed in the federal system. Yet there's a lot of funding for it, but those dollars never seem to make it to who they want. Now, exchange that to our mental health services that we have federally, like the Affordable Care Act, those dollar amounts aren't being used enough as well. So, just moving forward, really learning how to manage these policies is the best way to advance in the issue of mental health and substance abuse. So, in conclusion, mental health and substance abuse policies must evolve to better serve the well being of all citizens. As social workers, policymakers, and community members, we must critically analyze existing frameworks and advocate for meaningful change. By prioritizing evidence based practices, addressing systematic inequities, and promoting ethical and just policies, we can create a more compassionate and supportive society for those struggling with mental health and substance abuse challenges. Thank you for your time, and I welcome any questions or discussions. Here are my references. Thank you again for your time.